Good afternoon. My group today is going to be covering the palliative care nurse and the role it does in the community. As you can see from our nice little title here, the good, the bad, the caring. Palliative care nurse deals with all that, but the main thing palliative care nurse is caring. What is palliative care nurse? It says primary activities and scope of practice. Primary care of the primary activities of a palliative care nurse is usually go out in the community to visit people that are dealing with related health issues that are ongoing. The scope of practice is we go to people's houses, we help them deal with day-to-day functions, we do a lot of education, we help them deal with their comorbidities that they're dealing with and to help try to make their life better. Now, there is a lot of confusion between a palliative care nurse and a hospice nurse. Are they the same? Are they different? The answer is yes and no. You can see here we got the palliative care nurse versus a hospice nurse. You can read over them real quick. And you can see they both sound very closely alike, but the main key features you're going to find is that a palliative care nurse, their goal is to improve the quality of life for both the patient and the family. When a hospice care nurse does that, but their main thing is here, if you read the goals to focus on the comfort and quality of end stages of life. So palliative care nurse, their patient is not necessarily going to die within the next 6 months, where a hospice care nurse usually is within 6 months. They're both trying to help relieve pain. They're trying to relieve nauseousness. They're trying to help the person live as good quality life as they possibly can and help with the family. But the main care part for a palliative care nurse is that they are for the long term. Palliative care nursing came about all due because of all the government fundings with Medicare and Medicaid. Hospice nurses were having patients in hospice care for 2 to 3 years. Well, they came back and said that's not appropriate. The people in hospice are only supposed to be in the last 6 months. So palliative care nursing came about to help these people. As a palliative care nurse going into these people's houses and helping with their long-standing health issues like congestive heart failure and that, they started noticing a trend that you help to keep the patients out of the emergency room. You also cut down on the amount of inpatient care. So these palliative care nurses are becoming important because they're helping the family and the patient get the education and do what they need to stay out of the hospital, not wind up in the hospital every weekend. You can see here, the education we do is improving the quality of life. You're doing education to help improve the quality. Pain management's a big thing with this. You got people that are dealing with chronic pain to the part where it actually negates their daily function. So with the palliative care nurse, you're coming in, you're monitoring the pain, you're talking to doctors, you're helping change the pain medicine, maybe change the type of medication to keep them on. A lot of people that have long life ailments have a lot of depression and anxiety. Once again, as a nurse, you're coming in and helping with that. They've also done studies that have said it helps increase the lifespan, because if you have a patient that is dealing with it, they're staying out of the hospital and they're not as depressed and anxiety, they're more likely to be quality of life and they're not going to go downhill as much. Also, a large part of this is stress management. Once again, you're dealing with a lot of comorbidities, life, and spiritual careness. You're also helping these people that have a lot of issues because they are facing a long-term ailment. Help deal sometimes with if they're having a spiritual crisis, maybe you can help lead them that way. So my next cohort will be up here to give her part of the presentation.
Hi, my name is Lynn, and I'm here to tell you about the basic requirements for palliative nursing. Associate's degree is one, that's your basic 2-year degree, and then they also bachelor's degree. So the difference between the two is, of course, the extent of your education. Associate degrees tend to be more hands-on training. So for the Nursing Association, we are moving towards bachelor's degree for all hospital magnet status. Okay. Experience. So for palliative nursing, they require at least 2 years of experience in a med-surg and geriatrics. They encourage intensive care. There's also a hospice and palliative nursing certification. This is only offered in Pennsylvania. It is only one. You renew every 4 years, and you can either take the test to recertify, or you can collect your CEUs before retaking. But it's 4 years worth of, and it's directed strictly towards hospice and palliative care. Palliative care nursing and other disciplines or professions that the nurse interact with. Of course, we interact with doctors. We want to change our prescriptions, or maybe we need an intervention. Pharmacies that help us regulate our medications, make sure we're not overdoing medications, or introducing medications that interact inappropriately. We also deal with medical supplies. We also social services, and clergy is involved with palliative care nursing. Okay, I'm going to pass it off to the next one.
Okay, hello, my name is Terry. So I'm going to talk about some of the skills with palliative care nursing. And one of the major skills that palliative nursing entails is communication skills. So a lot of times, a lot of the patients are, dealing with critical conditions and sometimes some deadly diseases as well. So a lot of times they have a lot of questions about life and death. And sometimes some of the best ways to communicate with the patient and the family is sometimes silence. Just listening sometimes does a lot more than talking and telling them about what's going on. Also touch. Just a gentle touch on the shoulder can sometimes welcome the patient to become more open to a palliative care nurse. The capability to also explain complex information while clarifying the disease process along with medication and plan of care. A lot of times they're kind of lost as far as what's going on, and they have a lot of questions, a lot of concerns, and the palliative care is there. And they're also there from the beginning. So a lot of times people kind of consult with a palliative care nurse at the end of life when they're kind of towards, the end stages of their disease process. But with palliative care nursing, a lot of times they want you to start at the beginning. Like once you find out you have diseases such as cancer or, diseases that could become life-threatening, they want you to go ahead and consult with them at the beginning. Another skill that they usually entail is teamwork. So they work alongside with doctor, nurses, especially the nurses at the bedside, social workers, religious advisors, such as their pastors, because everybody have a different religion and believe in different things. They also work with pharmacists, like as mentioned before, to adjust medications that's needed. Nutritionists, just in case that they don't have an appetite, they're there to help out with that, and counselors. Psychosocial skills, they're able to work with family and anticipate needs. And that's one of the most important things with a palliative care nurse is to be able to anticipate what the patient and the family needs. And that way they're able to provide the care that's needed. Okay, and then also some life closure skills as far as addressing pain. That's one of the major things that palliative care nursing is there for, to help make the patient comfortable, improve quality of life. So addressing pain, and that's not only things they address things such as breathing issues, especially for patients with like COPD. They may be in their end stages. They're there to help make sure they're comfortable as far as breathing. And then they're there to also support family once life has come to a close. So they're not just there while the patient is, alive and breathing. They're also after death comes. They're there to help the patient family to go and, just to help them with the process after life is gone for their loved ones. And also interpersonal skills, to attempt to understand the personal reactions and to build a level of trust with the patient. And like I said, that comes with the patient being there to listen, to anticipate needs. That way that they are there to build that trust with the patient and the family. And then we get to what is so unique about a palliative nurse. They are there, of course, like I said before, to improve the quality of life for the patient and also for the family as well. They have the ability to receive palliative care along with continual treatment and illnesses. So that's one of the things that I did not know. There is a big difference between palliative and hospice. Hospice is there towards the end of life. Palliative care is there, while the patient is still receiving treatment. So they're there to just make sure they're comfortable while they can be, like for a cancer patient, they can still be receiving chemotherapy because they're trying to, treat their illness, but the palliative nurse is still there to make sure that the quality of life is there. Palliative care also does not depend on the condition, whether it's curable or not. So sometimes the condition can be curable, and if it is, they're still there to provide their services. And also, palliative care is always there with whenever a patient has hospice. So a hospice nurse can provide palliative care as well, but they'll be there. Palliative care is always there to assist with the hospice as well, to make sure all of the patient and family needs are met, and to make sure that the quality is there while while the patient is here. And even if it's curable, they're there as well. Okay, and it looks like that concludes our presentation as far as palliative nursing. I hope you guys enjoyed, and thank you for listening.